about how we... The effect of being diagnosed with prostate cancer varies between individuals and couples. I opted for the radical prostatectomy, and once I got over the original diagnosis, yes, I was anxious, but together as a couple we've been able to handle it. But there are other couples that are not so lucky as Pam and I, and they're the people that we're really trying to look after. Who's here for the first time? Oh, that's great. Yes. Well, is there anything that's worrying you particularly at the moment?
No, not particularly. But I guess the reason I'm here is because I guess there's sort of a vibration of anxiety about a whole lot of things, and I figured that a support group like this is a place to hear lots of people who've been through similar, worse, and just how they're facing it and things they're doing.
The biggest thing that we have to do is that we have to use our experience and don't talk too much. We have to listen to what people are asking, and then we can relay back our practical experience that we've had ourselves or of other people that we are now knowledgeable about.
And she's coming along to speak on bowel management for constipation and faecal incontinence.
Pam's a full-time worker for this cause, so she does a lot of telephone counselling before I get home. We get about 6 calls a day into our house, and the difficult ones, some men who would prefer to talk to a male, very few and far between, but they're the ones that I normally get landed with when I get home from my day job.
Some guys are still in tunnel vision for a long time after getting their diagnosis, and they don't want to speak about what can happen to them in their treatment options. So it's usually the wife that has this huge learning curve and knows more about the disease than the partner does. We need to know if there's a situation where that woman needs extra assistance, because she's probably got anxiety and depression herself rather than just the male with his recent diagnosis.
Is there anyone in the group that has been through a similar situation?
I knew so little about cancer, but the support group itself was good. I enjoyed it. So I still go there today. Now I'm 20 years down the line this year, and I come along here. I'm learning all the time. I see other people's problems. Sometimes if they're relating to the ray treatment, they can raise queries with me. But the point is, I'm always learning. You're in good company, friendly meetings. It's one happy family.
It's easy to talk to people that have been similarly diagnosed, and through the support group we can match people up with whatever they're going through. I can think of one couple who came to us in some despair because they weren't communicating with one another, and he didn't talk about it at work, and when he came home he didn't talk about it. But somehow or other they came to our support group, and we gave them some facts, we gave them some connections to medical professionals that could help them, and now they're a great couple that help telephone counsel mainly other people who are going through a similar situation. Beyond blue information about anxiety and depression, the women you can see going through it, and they'll take the fact sheets, and they're the ones, as Pam is suggesting, they're the ones that'll work through things in a realistic way, because mostly they're the health managers of the family, we find, and we get to men through women.
It's amazing how many times, and we were exactly the same, when we found out, prostate, what's that, where is it, what's it do? So it's not like women that they know they've got all the different sexual parts to them. Men think as long as their penis is functioning correctly and they're having great sex, that's all there is to the anatomy of it. They need to speak to their partner and talk to other men if they're brave enough to find out how they can best move forward.
My erectile function and urinary functions are recovered pretty well. I'd say to 90% to 100%.
It's good to be able to express yourself as well in front of people. As you can see there today, you can be very open and talk about anything at all. But I enjoy coming, there's fellowship, and my wife's been able to come along as well, so she's enjoyed coming along. And I like to spread the word also. I swim every morning and I have a pamphlets in my bag. And if I see a new guy in the dressing room, I say, you'd like to read this? Because there's so many ignorant people out there about prostate cancer.
The advice I'd give medical professionals giving information to their patients about mental health is that they've got to be mindful of the anxiety and the state of depression that people get in when they don't, for instance, have full sexual rehabilitation. They've got to think beyond the diagnosis and the treatment of the disease in the sort of crudest form and think more about getting the person back to a normal way of life, or as normal as possible. And now more and more people are being aware of anxiety and depression and how it affects the family. And we get to talk to medical professionals, including GPs. We encourage them to take it to the next level and get these people involved with proper literature that's available and speaking to people that can help them.